member from Calgary-Fish Creek.
Yeah, thank you, Mr. Speaker. And that leads me into this question. Today, public accounts heard from Alberta Health professionals on the deteriorating state of core health infrastructure, and the warning should not be ignored. The president of the AMA has said that deteriorating hospitals are really killing the system. Well, the president-elect told the committee that access is foundational to safety and access is dependable on infrastructure, so therefore infrastructure drives safety. Minister, if infrastructure drives safety and you've ignored the infrastructure, it means you're ignoring the safety needs of patients and staff. And quite frankly, that is unacceptable.
Thank you. The Honourable Minister to respond.
Mr. Speaker, as I've mentioned earlier, our Alberta hospitals are outstanding in the care they give to Albertans. Patient safety is number one. Our record with infections is probably some of the best in this country. We will continue to have the most accredited hospitals, and also, issues like mortality rate, infection rate, we are some of the best in this country. We'll continue to deliver services at an outstanding level, Mr. Speaker.
First supplemental.
Mr. Speaker, we're not talking about the incredible healthcare professionals. We're talking about the lack of infrastructure. Minister, the head of the College of Associations of Registered Nurses of Alberta described rural Alberta hospitals as crumbling. There are reports of insect infestation, ceilings caving in, failing elevators, and leaks that have gone ignored for 9 months. The doctors, the nurses, and patients are telling you this is a problem. We have been telling you that for years. So let's do this, Minister. Ignore us as the opposition, but let's listen to the doctors and the nurses.
Thank you. Honourable Minister to respond.
Mr. Speaker, I have been out in rural Alberta and throughout many of the urban cities, talked to doctors. Yes, there's some frustration. I have not heard that story, but we'll let that story stay over there.
Final supplemental.
Well, once again, Mr. Speaker, I'll provide the story through a FOIP. This government, your government, has done review after review after review. In fact, there are now 3 different lists of the repair work that needs to be done in hospital. One is kept by Alberta Infrastructure, one is kept by Alberta Health Services, and the third is by the party inspectors contracted by the government. Now, we have 3 different lists and 3 different estimates ranging up to $1 billion. And I can see why you're overwhelmed. So I'm going to make a suggestion to you, Minister. Pick a list, prioritize the project, make it public, and get it done.
Mr. Speaker, we have allowed Alberta Health Services to do the delivery of those repairs. We're spending $225 million now. We spent an additional $283 million since 2008. The repairs in our hospitals are moving ahead, maybe not as quick as everybody would like, but it's a big province, and we need to make sure we prioritize things, and that's done through Alberta Health Services in cooperation with Alberta Infrastructure.